Did you know that more than a third of people in the United States meet the criteria for being obese? That's over 60 million people. And if you have a mental or physical condition where you take medication that causes weight gain, it's easy for you to gain enough weight to be clinically obese. Fortunately, there's a new wave of medication options to help with this problem. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. There's been a lot of buzz lately around the drug Ozempic because it's been very popular for people to take and drop 30 to 40 pounds pretty fast. The drug is approved to treat diabetes, and because it works so well for weight loss, it's been in short supply because of the demand. This has made some people angry, saying that people who need it most aren't getting it because of all these other people who are taking it for vanity reasons. Well, yes and no. As of 2013, obesity has been classified as a medical disorder because it causes lots of other medical complications. The term is used pejoratively, and there's a lot of shame around body size. And until recently, helping someone lose weight was just saying, eat less and exercise more. But this isn't the real answer because weight gain is complicated. How do you know if you are obese and should pursue medical help to lose weight? One method used to define obesity is having a body mass index equal to or greater than 30, and commonly called a BMI of 30. There are lots of online calculators to measure BMI, but the formula is your weight in pounds or kilograms times 703 divided by your height in either inches or meters times your height again in inches or meters, or height squared. But know this. It's not that hard to be obese. For example, the average height of an American woman is 5 foot 4 inches. If that woman weighs 174 pounds or more, she's obese. A 6 foot tall man only needs to weigh 221 pounds to be obese. Now, there are limitations to this measurement as it does not take into account ethnic groups who may have more muscle mass. Where I come from, we call that being thick or big boned. But BMI is still a general measure of health nonetheless. What's this got to do with mental health? Many people with mental health disorders are overweight or obese. Some of the disorders like depression and insomnia can cause weight gain all by themselves in the absence of taking medications. Having a history of trauma triggers a stress response in your body, making you more vulnerable to gaining weight through hormonal changes that affect your appetite and increase the risk of disordered eating. And it also increases fat storage. Then the medications that we use to treat mental health disorders notoriously cause weight gain. The biggest offenders are the atypical antipsychotics, and then second in line would be the antidepressants. The usual way they cause weight gain is by increasing your appetite for carbohydrates. The antipsychotic medications can alter how you process glucose, leading to insulin resistance. Signs of insulin resistance are developing fat around your midsection and feeling hungry all the time. I've had some patients tell me their growling stomach keeps them awake unless they eat something before bed. And of course, they don't eat broccoli, they have a bowl of cereal. So with obesity becoming a defined disorder and not just a lifestyle or vanity issue, anti-obesity medications have become legitimized, and more of them are coming to market in recent years, and they keep getting better and better. One of the earliest medications was the drug fen-phen. It was a combination of the stimulant phentermine and fenfluramine, which is used to treat seizures. It worked by reducing your appetite. It was pulled from the market in 1997 because of serious lung and heart complications. I was in my residency training at that time, and it did leave a negative impression with me about using drugs to treat weight. I mention this because even with the newer medications, many doctors are reluctant to prescribe them for various reasons, including fear of long-term effects. Other medications that have been used for medical weight loss are Contrave, which is a combination of naltrexone and bupropion, and then there's metformin, a diabetes drug. I think both of these medications cause modest weight loss, with modest being 5 to 10% of your body weight. 5 to 10% is something, but it's not that much. Let's go back to the woman who's 5 foot tall and weighs 180 pounds. If she loses 10%, which is a lot for these older drugs, she loses 18 pounds. She's now 162 pounds, which reduces her BMI to 28, which is no longer obese, but it's still on the high end of overweight. Now we have a new generation of medications that cause weight loss. They work by reducing your appetite and slowing the rate at which your stomach becomes empty after you eat. This helps you feel full longer. They also increase insulin secretion, which is how they started as diabetes medications. But that's not all. They also stimulate brown fat, which you can think of as padding that we have in our bodies to help us stay warm. Hibernating animals have a lot of it. You don't see it in the form of love handles. That's white fat tissue. Brown fat is located internally around your neck, chest, and kidneys. When brown fat gets activated, it burns white fat for fuel. So these drugs indirectly cause body fat loss by activating brown adipose tissue. I think the fat burning is the big difference between these drugs and the older ones that only reduced your appetite. These newer drugs are called glucagon-like peptide 1 receptor agonists, or GLP-1s for short, and they are liraglutide, brand name Saxenda, which was approved in 2014, Semaglutide, brand name Wegovy, approved in 2021. These drugs are FDA approved to treat obesity, but for your insurance to pay for them, you need to have a BMI of 30 or greater, or you need to have at least a BMI of 27 with an obesity-related condition like high blood pressure, diabetes, or other evidence of insulin resistance, or high triglycerides, just to name a few related conditions. There are other GLP drugs that are not approved for weight loss, but instead approved for the management of type 2 diabetes. Examples of these are Ozempic, which is also semaglutide, but at a lower dose than Wegovy. For your insurance to pay for this medication, you need to have a diagnosis of diabetes. You don't need to have diabetes to get Wegovy approved, though, because it is approved for obesity, not diabetes. Tirzepatide, brand name Mounjaro, was approved in 2022 for diabetes, but it also causes significant weight loss, probably even more than Wegovy. These GLP drugs have been shown in studies to result in 10 to 22% weight loss as opposed to the 5 to 10 from the older drugs. Are these drugs safe? The most common side effects are nausea, vomiting, and diarrhea, as well as other gastrointestinal issues, maybe cramping. Rapid weight loss also can increase the risk of gallstones. Signs of gallstones are abdominal pain, nausea, and vomiting after you eat. You can take these drugs with antidepressants or the antipsychotic medications, but your doctors still need to do a medication interaction check of all the medications you take before adding it on to make sure you're not getting an unsafe combination from several medications. If you want to check yourself, WebMD has a handy drug interaction checker. You just put the medications that you take or want to take and see if there are any warnings. The other thing to be cautious of is that if you have liver or kidney disease, you may not be able to take these medications. I've focused on weight loss here, but these medications have other metabolic benefits that can help anyone, but especially the person who's taking an atypical antipsychotic medication. Other things that you should expect to improve are your lipid profile, and that includes total cholesterol, and LDL should decrease. Your HDL should increase, and your fasting glucose levels and hemoglobin A1C and blood pressure should all decrease depending on their starting level. These are things that should all be checked before and after you take the medication. Even though these drugs are considered safe, they aren't something where you want to email your doctor and say, hey, I'd like to take Wegovy. Can you just send it in for me? You should expect your doctor to get some initial blood work that includes looking at your liver and your kidneys to make sure that you don't have any compromised kidney or liver function. Now, this all sounds really good. Why wouldn't any and everyone who's gained weight not take these medications since they work so well? Well, for one thing, even though most people don't have any serious side effects, any medication has the potential for the rare but serious side effect. So it's about considering risks versus benefits. Another thing that can be a turnoff is the GLP drugs for weight loss are given as injections. Semaglutide has an oral tablet for diabetes called Rybelsus, but it's not as strong as Wegovy. People with diabetes are used to sticking themselves either to check their blood sugar or give themselves a shot of insulin. But if you're not there, you may not like having to stick yourself. A huge barrier to treatment, though, is cost. Insurance can get very nitpicky about showing proof that you qualify medically and that you've tried some of the other cheaper medications first. If they won't pay for it, the cash price for these newer medications are from $1,000 to $1,400 a month. And these medications have to be increased gradually. It takes 5 months to get to the final therapeutic dose of Wegovy. That doesn't mean you won't lose weight in these first few months. I've had some patients drop 20 to 30 pounds in the first couple of months. This isn't the standard way that it works, though. In fact, the studies show that people lose this amount of weight after taking the medication 6 months to a year. And as impressive as it sounds to drop weight quickly, especially if you've got a vacation coming up and you want to get your sexy back, losing weight that fast has downsides. You can lose a lot of weight in your face and look gaunt with saggy skin, which can make you look older. In general, though, you can also have that gallbladder complication of gallstones from too rapid of weight loss. In general, though, these drugs are designed to be taken long term. If you stop after a couple of months, you can gain the weight back, especially if you haven't changed your eating habits. So I think the way to use these medications, if you're using it to lose weight that you gain from psychiatric medications, is to get the weight off or get help getting the weight off with the medications while you also make major changes to your diet, which those changes will be easier to do with the way that the medication adjusts your appetite. The diet changes are not calorie restriction, but eating real food that's rich in nutrients. And I think with the medication, it's possible to change your eating habits in a way that changes what tastes good to you and makes it easier for you to not bounce back to craving carbs once you stop the medication. That's the next level that you're trying to get to after you free yourself from some of the weight. I want to mention that there are other weight loss medications that I didn't talk about for the sake of not getting too complicated. Going deeper into detail and giving you my opinion about treatment approaches is the very thing I'll be doing in my new mental wellness community. In fact, I have a cheat sheet on different medications and how we define diabetes and pre-diabetes and things that will only be available to community members. So if you want more education like this, in addition to having a premium community that's free of bots pretending to be me and trying to sell you drugs on Instagram, join me at mentalwellnessspace.com. Thanks for watching. See you next time.